Welcome back to our next presentation. Next up, we have Q-Linea and their CEO, Jonas Jarvius. Q-Linea is a commercial stage developer of solutions for rapid antimicrobial susceptibility testing, developed to improve patient outcomes for sepsis and address antibiotic resistance. And with that, I leave over the word to you, Jonas.
Thank you very much, Jakob. Yes, welcome to the presentation today. Will be a 20-minute slot roughly, and we're going to talk about Q-Linea, what we are, what we do within the area of infectious diseases. If we look at the next slide, which is really our disclaimer slide, which we have to present in case I make any forward-looking statements. But if we then move to the next slide and look at some high levels of the company and achievements really so far. As we said, we're doing development for disruptive infectious disease diagnostics. This is an area with a big unmet need and an area of a growing concern. So it's really important to have better tools, better diagnostics within this field. We're a company, roughly 180 employees and consultants as of today. We could also announce earlier that we had our first commercial order of the system. We have a worldwide sales partner, Thermo Fisher Scientific, that promotes the instruments as of today in Europe, and we do the same in Sweden. So very happy about that. We're also coming back from ECCMID, the largest infectious disease conference in the world, from Lisbon earlier in April. And we had a very strong interest for ASTar, and I'll come back to that a little bit end of my presentation. Another thing that I'm very proud about is, as you know, we are moving in the last stage of our submission to the FDA for, of course, US market clearance. And the FDA has announced our product to be a breakthrough device. And of course, this is a very big thing for us. And it also gives a recognition that what we do really can aid and benefit in better care for US patients. Podler, our technology development, also huge interest at ECCMID. We are making good progress there in discussions with commercial partners and looking into the way to take Podler to the market. But if we move on to the next slide, I will talk very briefly about the area we operate in. I mean, the first product is toward to blood infections, and sepsis being the most severe condition. It's a #1 killer in the US, the #1 cost driver in the US. And what we can also see that worldwide, a patient will die every third second from sepsis. So this is a huge problem. The problem today as a physician is that the current diagnostic workflow takes too long. And that really means that when you start therapy for these patients, half of them are actually on the wrong therapy. And around 20% of them will have died before you get the appropriate answer. And this is where we want to come in to make a dramatic change in the timeline and potential outcome for these patients. But also, if you look to the right, another area of huge growing concern is antimicrobial resistance. Has been posed as the biggest threat to mankind. And of course, here we need to use antibiotics better. We need better diagnostic tool to make sure that we only use it appropriately and the correct type of antibiotic. We, of course, as a company cannot solve this huge problem ourselves, but we can be an important piece of the puzzle and really aid for future generations. If we then move into the next slide and talk a little bit more about ASTar and our product. We developed ASTar together with customers, and now when ASTar is on the market, we can really see that all the work we built into the product development pays off. It's easy to use, it's fast, it's comprehensive, and it's very precise. And when we see the feedback from customers now, we really can have a sense that all these 4 pillars are important if you're going to make a big change in this field. If we then move into the next slide and have a look at the breakthrough device designation by FDA, as I said, this is a huge thing for us as a company. And you can see to the left, I mean, the real reason FDA do this with the devices is, of course, to put a priority on them. And the real purpose is, of course, to provide faster and better healthcare for US patients. That's really what FDA is all about. I think interestingly also with the breakthrough, it opens up to some possibilities to looking at specific reimbursement programs that may or may not be eligible for ASTar, but it still opens the door. And of course, in our sense, we do hope that after submission to the FDA, we can have perhaps a more speedy approval of our product. So fingers crossed, and no promises made, but all very happy about that so far. So if we take the next slide and look how ASTar comes into the diagnostic workflow. As I said today, it takes a long time to diagnose these patients. And on the upper part of the image, you can see here, it's a multi-day, multi-step process. You start empiric therapy immediately, of course, and then you have to wait several days, and the lab personnel have to do many, many steps with the samples in order to get to the answer that you really want. And that answer is, what antibiotic and what concentration should I use to treat this unique patient infection? Because bacteria are different, some are resistant, some are sensible. And of course, you need to find the exact right treatment regime for each patient. And as I mentioned also earlier on, around 20% will actually have died today because current diagnostic workflow takes too long. So if we look at the bottom part of the image, we can see where ASTar comes in. I mean, seamlessly integrated in the lab workflow. It only takes 2 minutes to start the test, and then you can walk away from ASTar, meaning that the lab staff can do a lot of other tasks, COVID testing in the past, for instance, and a lot of other things that they need to prioritize. Then within 6 hours, you get actually the most comprehensive answer of any AST system on the market currently today, meaning broad panel of antibiotics and broad concentration ranges. But also in this picture, I highlighted our next technology, Podler, because actually today, and I will come back to that later on in my presentation, one real big hurdle here in the diagnostic workflow is transporting the sample from the site of sampling to the central microbiology lab. This transport can take 10, 15 hours, depending on when and where it's taken. And of course, if you're a septic patient moving into septic shock, the mortality increases with around 8% every hour if you're on the wrong treatment. So time to actionable result is really important for these patients. So this provides a coverage of where we are right now and what we aim to go into the future. If we take the next slide, we can also see that this is just testimonials from customers having tested the instrument, and really can see that it is super easy to use. I can use my staff for other tasks. And this is, of course, very important for nighttime operated labs where you have very few personnel working, very usually low educated, but they can still run an ASTar. If we move on with the next slide, we can also see that ASTar is built for the medium size and up hospital, having a huge capacity to run a lot of samples, both, of course, high steady state throughput, but also handle peak loads. And we've also designed the system to handle fully automated samples such as blood. And as we now presented at ECMID, also going into the semi-automated for isolates, not as time critical. And I think the beauty of ASTar is that it's designed so that fully automated, you have a sample preparation cartridge and a disk. You can see that to the lower right. Semi-automated, you only load the disk. And this means that we can address different price points for various tests. If we then look at the next slide, of course, a very important slide, but we'll take it very briefly. You have to do clinical studies for these type of tests. And when we did test ASTar, this is results from our CIVD study, I mean the European study, we exceeded all requirements by margin. So providing the correct answer as to reference, providing the right treatment category with a very high reproducibility. So also, if you look at the right, you can see the breadth of our panel. We have highlighted there are 2 other companies on the market that do fully automated AST analysis. And of course, in this type of graph, you want to be as far up on the higher right as possible. And you can clearly see that ASTar can provide a broader answer per test. And what does that mean? Well, it really means that if you start a test in ASTar, the likelihood that you can act on that test, finding the appropriate antibiotic for that patient, is higher, of course. And that then means that you have to do less follow time-consuming tests. So I think this is an important aspect of our product. If we then move in to the next slide, we can also see that independent health economic studies have looked into the value of 24 faster AST with very significant numbers. So reduced mortality quite dramatically, but also if you can go from broad spectrum treatment to narrow spectrum treatment faster, you reduce the pressure for resistant development in the patient and in the hospital, as you can see in the middle part here, but also to the further right, as I mentioned, if you progress in sepsis from sepsis to septic shock, you will end up in an intensive care bed, the most expensive beds in the hospital. You have a team around you trying to keep the blood pressure up, trying to fight the infection. And this study could show that you could leave that intensive care unit on average 2 days faster. This is, of course, a dramatic cost saving for the hospital, since all these type of tests in general are DRG or lump sum reimbursed. Any cost you can save really makes a difference. So when we look at ASTar, what it can provide, it really provides benefits for the patient, society, and the hospital. And we are now moving forward with our own health economic study, and I'll be happy to come back to present more details on that within the next couple of months. But if we move on and take a step back from really the high level, this is just one example from ASTar being run in a hospital in Sweden, south of Sweden. It was an elderly gentleman, had neurosurgery, developed sepsis. He was put on pip/tazo, a common treatment for these type of infections. And on the lower part, you can see all the timestamps, what happened with this patient in the diagnostic workflow. So the day after he was admitted to the dome, he had a positive blood culture, meaning presence of bacteria in the blood. We could download ASTar, or the staff could load ASTar, and already the same day, ASTar could provide a result saying that, first of all, the patient is resistant towards pip/tazo, or the bacteria in the patient. So this is the wrong treatment. But also, of course, and more importantly, you could also say what antibiotic to choose. So this patient was moved to meropenem, and he had a very speedy and good recovery. So this is just one example that these type of tests make a difference. And also, as you can see on your top right panel there, we could provide 13 more antibiotics than this hospital traditionally tests. And that really gives a better opportunity to tailor the treatment for any specific environment. So it makes a difference for individuals, not just the society. If we then move on and look into the presentation, I mean, we look at the market. We developed ASTar as a platform. We have released blood now as the first product, looking at sort of $1 billion addressable market, Europe, US, more or less. But we've already demonstrated data on isolates and in urines. Of course, in our long-range plan, looking at what products to follow, we are looking into that. And currently, isolate is on the top of our list to follow after blood. If we then move on and take the next slide in the presentation, of course, how do the system function in the field at real hospitals with real patients? So this is a result from a really large commercial evaluation performed by our partner Thermo Fisher Scientific, multicentric study, around 500 samples tested, patient samples tested, which is a big number. And on the lower part, you can see that the results of this study was tremendous. We had an essential agreement, meaning that we provide the same result as a reference that was even higher than our CE mark. And I think that's the nature that in our CE mark, we challenged ASTar with some really difficult bacteria that you very rarely see. But of course, we want the system to be future-proof. But I think on the second to those line here, I think it's one of the most important part. You can see that on 98.7% of everything you loaded ASTar with, we could provide a result. So very high likelihood of investing in an ASTar test could give you the result for that specific patient. So really proud about that. And of course, this then serves as a traction in the market, in the commercial and sales funnel, of course. If we then move into the next slide, we have been focusing on ASTar today. I will spend the last sort of 5 minutes of my talk talking about our next technology. So Podler, it's called. And as I mentioned, for septic patients, you take a blood culture to detect presence of bacteria in the blood. But they need to be transported from the site of sampling. It could be an ER department, it could be a satellite hospital. And that transportation time for these critically ill patients takes too long in general today. So what if you could have a device that could start that diagnostic workflow immediately after you have taken the sample? The good part is that it could benefit every single one of these septic patients, but it could also sort of even out the score a little bit. So even if you're sick and have your sample taken at a small hospital, you can have the same level of care as if you are sick at a university hospital because you use time in transport. So if we take a look at the next slide, this is just some high-level data on what typical time does it take. On the upper part, it's more focused on that you're one hospital, but it depends on what time of the day or night or weekend the sample is taken. So if you're having your sample taken during the day shift, it takes around 2 hours to have the sample sent to the microlab, and that's probably okay. But if the sample is taken during the weekend or even during the night, we can see that it takes on average 6 to 13 hours for the sample to arrive. And this is from the same hospital. And if we then look at the lower part of the panel, where you can see today we have a lot of centralized labs because, of course, of cost savings. We can see that depending on the distance from the satellite hospital to lab, we have 17 kilometers, 22 kilometers, 2 examples from Sweden, 1 from the Netherlands. We can move up to the plus 12 hours of just wasting time for this patient group. So Podler could, of course, utilize all this time and provide the same level of care as for a centralized hospital taken daytime. So if we look at some data on the next slide, we have been doing extensive testing of Podler, and we can see that not only could we save the time in transport, but also compared to the traditional cabinets, in general, we're actually faster on detecting growth in these bottles. So I think very, very positive development. And what we're doing right now is moving together with a manufacturer. We're doing transfer of manufacturing from our prototypes to production-ready units. So this is something I really look forward to see the development of Podler and how it can actually, in my sense, transform this field. So then the question is, how big is this field? So if we look at the next slide, when we look at the market for blood culture, we can say that on average, if we just focus on Europe and US as a start, it's over $1.5 billion addressable market. But of course, and obviously, Europe and US are not the only one having struggles with this type of transportation. So if you look at Asia Pacific and rest of the world, we see this as a significantly sizable market. We have a completely unique technology to address that market with. So it's still in development, but I'm really happy about the future for that. If we then move into the end part of my presentation, I would just like to summarize ECCMID in Lisbon. Again, the biggest infectious disease conference, huge interest. I mean, first time people are meeting after the pandemic. We had our booth there, our partner Thermo Fisher Scientific also, of course, presented ASTar in their booth. And we had a very strong interest from many, many customers. We met all our targets we set up before the conference. So we came back, both companies, with a strong lead list, of course, trying to move them into opportunities and eventually, hopefully, sales. So we as a company could also present our next product for ASTar, the gram-positive panel, and received very, very good feedback on that. And Podler basically went viral. The interest for Podler was high and much higher almost than we anticipated. So very good and strong traction. And I think both teams from the companies left ECCMID with a very good feeling that we are developing a good product that really interests people. If we then move into second to last slide, this is just our way of looking at our technology and capabilities within infectious disease diagnostics. I mean, there are 3 main pillars, basically, from left to right: blood culturing, identification, susceptibility testing. I mean, susceptibility testing, we do have ASTar. That's on the market, and we try to extend the offering on ASTar. We have also illustrated our point-of-care platform for urinary tract samples, maybe in the 5-year scenario launch. For identification, we have absolutely unique technology to do a highly multiplex ID direct from venous blood. Again, it's a little bit, I would say, too disruptive. The market is not ready there, but it has been proven on patients with very good results. And then, of course, on the blood culture, we have Podler. So I think we as a company look with very positive signs on the future. I think we are having a very good opportunity to develop and grow with the market demands going forward. So with that, I will just have the next slide and pause and open up for questions. I think this is important. We develop our technology today, but with the rise of antimicrobial resistance, it's really important for the next generation to be able to have the same or similar care as we have. So with that, I would say thank you for my time and open up for questions.
Okay, thank you very much, Jonas. I think we have time for a few questions, and I'll start on one on the sort of launch and commercialization of ASTar. I mean, we're slowly starting to see, that you are starting to sell systems, and sales increased a bit here in Q1. But overall, just to get a view on sort of the midterm, how is the number of, I guess, evaluations or the general interest from customers developing at the moment?
Yeah, so I mean, what we did announce also in our Q1 report, we see that the sales cycle is around 9 months. So it's quite long and basically on par with our other colleagues in the field. Of course, we want to shorten that time because a lot of work we do now is for 2023 and so on. So we are sort of working well ahead of the commercial sales. But what we do see is we have a very large interest in customers that want to try the system in their lab, evaluate it, and before they take a decision to buy it. And I think that would be the case at this phase of the launch, that you want to test the instrument, see what it can deliver, see how it works in your lab, and then take a decision to purchase. So far, I think that has been a very good conversion rate. I'm happy with that. But we're also seeing that we are lacking some capacity together with our partner, Thermo Fisher Scientific, to really do the number of evaluation that we would like. So, of course, this is something to build up the capacity for. In general, it's positive that it's in that direction, that you have a bigger demand than you can currently meet. But, of course, you want to meet all demands.
No, I agree. And if we look into the US market, I mean, you mentioned the breakthrough designation, which surely should help you get that market cleared. But once you get the 510 clearance, how should we think about the potential sort of uptake curve in the US compared to the European market?
Yeah, I mean, what I think, and this is some speculation, what we've already seen actually is quite a big interest for hospitals in the US to try and test ASTar even before approval. Of course, that's not the sale, but I think that is better for having a running start. I think the overall sales cycles from university labs will be similar in the US as in Europe. But I would say the big change here is first of all, we have a year of traction in Europe, so the system is more well known. You have more commercial labs in the US, which do not have to go through tenders. So I do actually anticipate to see a little bit different adoption curve in the US. Also, in general, I would say US is more familiar to these automated systems. So my expectations would be to see a faster adoption rate when we do come to the US, in my opinion.
Okay, and if we look at the ASTar system, as you said, you can test or you have a very broad panel with 25 different antibiotics possible. Just wondering, to what extent is this a potential selling point for ASTar, also considering the increasing resistance problem we see here globally?
No, I think it's very important because, I mean, if you have a limited panel, as a lab, you do know that if you start the test, you will have to do follow-up on a number of patients. And that follow-up will be traditional and slow because that's the way the world is. So having a system, and when we also get feedback from customers that they really get a wealth of answers, I think that in the long run, it's going to be extremely important because today you do invest in new technology, and you want to be able to act for this patient group as fast as possible. So I think that value is just going to increase. And as you commented on, we have 25 now on the disk, but we still have some room to spare on the disk. So maybe that would even grow further into the future. So I think it's actually important. And when we see customers actually get these results back, it provides a broad answer, but also the possibility to tailor treatment. You can choose, if you have 2 antibiotics to choose from, you can choose the one with less side effects or low resistance settings in your hospital. So you provide even more nuances to tailor the treatment for any specific patient and location. So yeah, I think it's going to be very important actually.
Okay, and if we move on to Podler, I mean, it seems like the reception here at ECCMID recently was very good. And just looking forward, what is sort of the next step in terms of clinical evaluation or the regulatory pathway for that product?
So first of all, what we're doing now is, of course, also talking with the commercial strategy for that system. So, and that it's going to be important and might affect also the other 2 steps. But what we do want to do is test the system on patient now as a first step. Then we are also really looking into exactly what level of certification is needed. It may not be a full-blown clinical trial that's needed to have that product approved. We, of course, need to do a patient study no matter what to show the customer that it works. And this has taken a little bit longer to decipher that. So in us, of course, one path will be quicker, but otherwise we will simply do a regulatory study as planned, and that will, in that case, happen in the US first and then move to Europe, I would say.
Okay, and lastly, just I mean, there has been some interesting transactions in the rapid AST space here over the last couple of months. I mean, on the one hand, I guess your peer in Uppsala, Aktier, being bought out by Sysmex, and then we also had Specific Diagnostics being bought by bioMérieux. So just overall, what's your view on these transactions and what's happening in the rapid AST space at the moment?
No, I think you're right. I think that the larger players are realizing, or have done for some time, the value of this, and they need to move their positions, because you can't be a large company in this area and not provide rapid AST in the future. I think you will not be as competitive. So I think it's an indication. First of all, it's a verification or validation that what we do is important. People actually care about it. And I think we see companies taking their strategic positioning forward. So I think it's starting of something that might develop further over the next years or so.
And could this be a indication that your relationship with Thermo Fisher would intensify?
I wouldn't like to comment on that right now. I think overall, big companies are moving their positions, but I don't think I would say anything more on that. Sorry, Jakob.
Okay, I totally understand that. That was all the question we had the time for today. So I would like to thank you for participating, Jonas.
Thank you very much. Thank you for also listening in, and thanks for good questions, Jakob.
Thanks.
Thanks. Bye-bye.